Hi, I'm Dr. Margreet Barnardt, your host of the Birth and Baby Show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms, midwives, and birth workers to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust. For this episode, I will be talking with Ruwaida Moola, who is an independent midwife. She has her own birthing unit. It's called Birth on 5th, and it's in Linden, Johannesburg. And we will be talking about everything in and around midwife-led care and if it's right for you. So this will be a very insightful conversation. I'm very excited about this. This episode is sponsored by Zinplex Pregnaplex. Pregnaplex has been specifically formulated to provide support during your special journey. The carefully selected ingredients have been created to provide you with essential nutrients needed before, during, and after pregnancy. Every tablet is a tribute to the timeless journey of motherhood, thoughtfully designed to support you every step of the way. Our signature blend is enriched with zinc, known for nurturing radiant skin, supporting a healthy reproductive system, and bolstering immunity, and folic acid, which is an essential nutrient for a healthy pregnancy. Together they weave a protective and nourishing cocoon, ensuring both you and your baby thrive in harmony. Available at Dischem, Clicks, or your local pharmacy. For more information, visit www.zinplex.co.za. Hi, Ruwaida. I'm so glad that you're here with me. I love talking with midwives. And today we have a topic that's very close to our hearts because we embody it, and it's all about midwife-led care. So we're going to unpack that because I think not everyone is aware of that option or understanding what it means. And if you and me had our way, I think we would have every mom that's pregnant for the first time to start the journey with a midwife, right?
That's so true.
So Ruwaida, thank you for spending precious time with me. What in your world is midwife-led care?
So firstly, thank you so much for having me. It's always an honor to be with you, so I appreciate it. Thank you so much for having me. Midwifery-led care is, I think, and that's what people don't know about what exactly is it, because you go to a doctor to have your baby, right? But they don't understand that midwifery-led care is something that midwives, it's a primary, we are the primary caregiver, so they come to us throughout. We're experts in our field, so we're experts in low-risk births, and if a mom wants a natural birth and non-intervention, and she would like to go the way her body has intended, then she would then follow through with midwifery-led care. Mm-hmm. So midwives generally would see moms low risk, and lots of people, what is low risk, you know?
Yeah.
It's moms that don't have any medical complications or medical illnesses that warrants and needs medical treatment. And that is the client will then come to us, and we guide them throughout the pregnancy, and we discuss the birth options that they want. So we don't only focus on the birth itself, but we see antenatally. And you know, the nice thing, midwives, we don't only look at the baby and the tummy and the mummy. Mm-hmm. We start off from the brain, how you're feeling emotionally, and what do you want out of your birth, and pregnancy, how's the pregnancy progressing, and then we take you through the birth as well in giving natural and vaginal birth, and that's what the midwife specializes in. Yes. A vaginal birth outcome. And midwifery-led care, we see our clients throughout the pregnancy. We always want them to be seen by a gynecologist or obstetrician, because that's who we work with as our backup. And then we see them postpartum as well, and that is midwifery-led care from the start right until their next babies.
That's right. So it's that whole continuation of care that you offer, and you can offer that in your setting, Ruwaida, because we didn't talk about that yet, but you are an independent midwife, right?
Yes.
So you provide this whole continuation of care.
Yeah, absolutely. And we try and include, so we try and incorporate other care providers as well, because a mom has so many entities in her pregnancy, so she needs a provider to take care of her, and then she might be having a bit of aches and pains, and she'll need a physiotherapy to take care of that. So we try and incorporate all of that at the home birth unit as well.
Oh, amazing. Yes. Yeah, we'll talk about it a bit later, where people can find you if they want you and what you specifically do there. It's amazing. So midwife-led care is really for every woman that's healthy. Ideally, they would have a midwife to have that personalized care, that look at your total picture, and to really coach you to do what actually you as a pregnant mom need to do. Hey, it's yes. Her body. It's just empowering her and coaching her. I find like as a midwife, you're very much a coach then, right?
Very true.
Yeah.
Because everyone says when they have a baby, it doesn't come with a manual, right?
Yeah.
So with moms, we're their manual to guide them through that pregnancy.
Correct. Yes. Yeah. Exactly. It's so rewarding. So what would be the benefits to go through a midwife?
With midwifery-led care, when moms come and see us, we take them throughout the entire pregnancy. So we with them from the start and into labor as well. When moms go into labor, they give us a call, and the big difference with a midwife and other providers is the moms have our cell phone numbers. So they can reach us day and night.
Sure.
Okay. So we always on call for the mums, and they have our contact numbers to do so. And when they're in labor, we with them throughout the birth. So they're not seeing another midwife relying on a specific shift, and then that shift leaves, and then they start again building up another rapport with another midwife or another provider. They have continuation of care from the start into their birth. We meet them at the birth, and we're there to take them through labor and birth itself, and whichever outcome they have, be it a cesarean section or a vaginal birth, because at that point in time, there are times where things change, we're still with them. And after birth as well, we with them in the postpartum period, so we're able to assist them with breastfeeding and assist them with going through the entire process of becoming a mother. And that is the main benefit of it. I think it's more a personalized approach, and I think that's what lots of moms look forward to today. They want somebody that understands them, that there's somebody that's been there from the start, and that's the person that's actually going to be there in their space, because it's such a sacred space.
It really is.
So that person is going to be with them at birth. And a lot of our clients have birth preferences that they'd like, and cultural preferences that they'd like to bring in, and that's what we're there for, to ensure that it unfolds, and we make it extremely special for them, because it's not my birth and it's not somebody else's, it's theirs. And we want to give them something that they can look back at and be happy, and they have a success story to actually tell after that birth.
Wow. So I almost hearing what you're saying, it's very much quality care, because you have that amazing input, but I can also imagine this trust that you build, and that whole trust relationship, to trust a person with your journey and with your birth. You need to build that trust relationship. So that is a very much benefit from this continuation of care.
Absolutely. And a lot of moms think that it's not a dictatorship. It's always informed consent. So the mom can say, this is, can I do an internal? If the mom says no, no is no, You explain to the mom what she needs to be done. So we empower the mom so that she's able to make informed decisions. And her decision, she's the most important vessel in all of this.
Absolutely.
So her consent and her acknowledgement is what actually counts the most throughout. And that is the benefit of having that personal touch when you have a midwife. By following through with the actual birth and doing skin to skin and doing delayed cord clamping, because there's no time limit in midwifery-led care. You give the mom, and her birth is her time, and we're just there to facilitate it and to ensure that she has the safest birth outcome. And that's what they have. They have that throughout of their pregnancy and their birth.
Yeah, it's amazing. That's amazing. And in your experience, you would obviously love to help all women, but that's not possible either. So is midwife-led care for everyone, or are there limitations?
There's definitely limitations, and I think that's something that we have to acknowledge. We have to know that there's limitations in everything that we do.
Yeah.
And there's specialists that handle things when it comes to an end point and we cannot do more. So midwives specialize in when there's an uneventful pregnancy. Pregnancy is going extremely well, but if the mom is diabetic or she's a triplet pregnancy or there's any complications, then we hand over to our obstetricians. And that's why we work so closely with a beautiful team that we can refer to. As much as we specialize in low-risk vaginal births, the obstetrician specialist he specializes or she specializes in surgical births. So when there's a cesarean section, that's our limitation. We call in the obstetrician.
Correct, yeah.
We're also not doctors, so we cannot prescribe. Okay, so when we need specific prescriptions, that is where the obstetrician or the doctor steps in. And when the moms, we have, for example, the home birth unit and hospital birth, we guided by guidelines in South Africa. Social media is a big thing. Social media is a big thing, bad thing sometimes, because many moms look at things that are done in other countries, twin pregnancy at home, beautiful twin pregnancy, or a vaginal birth after cesarean section at home. But our limitations in South Africa, we cannot do that according to our scope of practice and our guidelines. Vaginal births after cesarean section and twins, they can have magnificent births with a midwife in a unit that is in a controlled space, in a hospital setting, or a midwifery-led hospital that has a theatre on site. So they can still have the midwife, but just in a different birth space.
Yes.
So there's those type of limitations that we have. We have. The other thing is medical aid. I think a lot of clients,
yes,
they think, okay, your limitations is find a midwife. So you would go ideally to a place that the midwife births at, but a lot of us don't work with medical aid. Okay, so it's not the cheapest option sometimes, because you need a midwife and then you need a backup obstetrician. So with that as well, find a midwife that is in your hospital or network, or because we can't step out. We don't have practicing rights in all hospitals, so you'd find a midwife in your specific area and within your specific cover.
Yes,
I think that's also quite important to just say.
No, absolutely. That is definitely a limitation sometimes. It's pure finances also. That's good that you brought that up. Because midwifery birth is not, sometimes you think, I will go the cheap way, I will do the midwife way, but it's not a cheap option, it's a quality choice.
Correct.
It's a philosophy almost that you have, like I want to do the natural birth, and acknowledging that a midwife is a specialist in that. But you always have to bear in mind that there might be added cost should there be a need for a cesarean section or something for your baby. So that is all calculated cost that you need to consider. Yeah, so that is definitely could be a limitation. Ideally, you're in an environment where the whole system supports midwife-led birth, and it is all, the referral system is for everyone clear, and you can just go and refer, and it's not so complicated. But in South African context, you need to consider these things.
Correct, because you come to a midwife, and I get a lot of inquiries. I'd like to see a midwife, but the expectation is everything will be covered. And we have to say, I don't do fetal anomaly scans because I'm not a fetal specialist and I'm not a sonographer. You might be having a scan with me, but I could not diagnose something which is so important, and that's another limitation. So you have to go to a fetal specialist or an ultrasonographer, a sonographer that's going to do that specific scan.
Correct.
So referral is a big thing, and we do have a specific limit, and that's when we refer out.
Yeah, we work in a team. That is our reality, multidisciplinary team.
Yes.
Yeah. So for the right mom to be with the right healthcare providers is crucial.
Absolutely. Yeah. And that you said it so beautifully. We work. It's all teamwork.
Yeah, it is teamwork. Absolutely. Wow. So. In your experience with the moms that you've birthed and stuff, we did talk a little bit about the benefits of birth, but I want us to highlight a little bit what do you see that you want to give to the audience that are listening, why they would really want to consider a midwife, because you see it all the time, like why it is so good for the moms.
Yes, your body was meant to do this, so so firstly the mom's mind needs to be set to that. And when she undergoes the natural process, she has this amazing dance of hormones. I call it the dance of the spectacular hormones that is happening. And we help to facilitate that by putting on dim lights and increasing our oxytocin and all of the good things that happens when you undergo a natural process. So clients that want to birth with a midwife want to have a natural birth. They don't want intervention. They don't want their water to be broken as soon as they walk in and a drip to be put up and an induction to happen. They want their body to do what their body has intended to do, And that's what we're there to facilitate. And when they undergo this beautiful process of this dancing of hormones and this high oxytocin, when they give birth, what high they're on.
Yeah.
That adrenaline is pumping through their body, and they have this immediate love for their baby, and they have all of that. And moms, it's okay if you don't feel it as well. It's not something wrong, but this is what we want to facilitate. And when we're able to facilitate that, and we're able to help moms go through this natural process and have this natural release of hormones, they transition from their maiden to their motherhood in almost a better way, instantaneously. When they put that baby to the breast, they know it's skin to skin, and they're able to breastfeed with or without assistance.
Yeah.
But the success of breastfeeding also will last much longer. The risk of postpartum depression decreases. The client satisfaction increases because they know that they've actually done what they wanted to deep inside, and that's exactly what midwifery-led care is about. It's allowing the mother to go through the natural process and to be there to facilitate it and to guide them. And if a mom wants that, and she wants to experience that is, with no time limit, let's say that, with no time limit. She's not put on a clock, but allowed her body to do what it's intended to do. Midwifery-led care is the best way of doing it.
Yeah, absolutely. It's so beautiful. I can just see your passion come out when you just talk about it, because you've seen it so many times, right? And I wish so many more women could experience it that way, because it is absolutely true. If you see the power of women's bodies and you see what they've achieved afterwards and how empowered women are, and how natural then this whole motherhood also come to them, because they've now gone through this natural birthing process, and they learn to listen more to the intuition by mothering and all of that. It's so powerful. So Ruwaida, I know in our environment in South Africa and in many other countries, there are many women that are very scared of this specific natural midwife-led birth, because I hear so many horror stories about birth and complications, and it's like, ah, thank God I was in a hospital, you know.
Yes.
But yeah, if they would only understand that, unfortunately, most of the problems happens is because we don't want to go with the natural way,
Yes.
right? And I think as midwives had a privilege to really see that with natural birthing, that nature has thought of everything.
Yes.
Of everything. It won't let you down anyway. It is really thought of every detail.
Yes.
And when we distrust that and we want to interfere, we think we need to help, that is often when lots of interventions start to be needed. So
that, you actually said that, so it just makes me think of a client. She was terrified of birth. I think more so because the family didn't want her to have a midwifery-led birth, but she wanted to.
Yeah.
So already there was, conflict. And she came into labor. So the other thing with midwifery-led care is we give you the exercises and the preparation and all that antenatally. So when you go into your labor, you know your warning signs, you know what to look out for, you know how to manage the initial stages of labor. And when you go into hospital, you clamp down immediately, whether you're 2 or 3 centimeters, and you're early and you're not even in your active labor, because of everything surrounding you. There's so many, it's a hospital. It's a medicalized procedure. And labor and birth is a natural procedure, something natural. So you're going with a natural into a medical space, and you already clamp down. This mom came in smiling, and I said, sure, I'm sure, in my head, I'm sure she's about, just starting about 3 or 4 centimeters, because she's still smiling and she's coping well, and I know how terrified she was.
Yes.
She was 8 centimeters.
No way.
First time mom. Absolutely no pain relief, but she didn't need it because she allowed her natural endorphins to do its thing.
Yes.
And here, if we had to inject her with painkillers, it shuts down that natural endorphins, which is so high, and we interfere with the natural hormones, and that's when it all goes wrong. If I had to break her water and take her to a different, it changes that.
Absolutely.
And we just let the mom be.
Yeah.
There's times for intervention, yes.
But it should
most
be
of the
minimal.
time, yes, most of the time. You only, and that's the thing with midwifery-led care, we're able to detect when there's a variation.
Correct.
And we're able to detect when there is a need for intervention, but it should never ever be a routine.
Exactly, yes. Yeah, man. If we could just make every healthcare birth worker aware of that, because I think it's often also ignorance about the not knowing natural.
Yes.
But it's very important for any listener to take note of that, is that once you start interfering into this whole natural process, that is when other interventions is needed. So it's not like, oh, they saved a day. It's like, no, we started off wrong.
Yes, yes.
So hopefully that gives some more confidence in women that are really wanting natural to not have that fear, because I've heard that people talk out there, and often it's like the doctor saved the day.
Yes.
But he didn't. She maybe started the problem. And as medical professionals, we have to own up for that. That's also.
True. Yeah.
Yeah, I really I admire all these initiatives, that are out there to improve emergency care and bleeding after pregnancy, etc. But I want us to talk more about why they happen so often. It's because we don't trust the natural process.
Yes.
So we need so many more of you.
And you.
In your ideal world, what is your dream for women and midwifery?
My dream, it's almost a dream reality. Okay? So if we could, the Caesar rate is extremely high in South Africa. And it's because stories of fear spread so much faster, and it makes good TikToks to complain about something. And empowered births sometimes are not spoken about as often as it can be. And mums, I'd like to encourage you to share your positive birth stories, so you can encourage the youth, and you can encourage the younger mums, and you can encourage the future mums, and tell them of your beautiful natural process. because 90% of the moms, I'm sure, didn't actually use any intervention.
Yeah.
You know, that's possible, and that's the way things were before. So in my ideal world, it's getting back to the way things were before, where the midwife is your first line. You know, if you want a natural birth and you trust in your body, you go to a midwife. And only high-risk medical complicated births would then go to an obstetrician.
Yeah.
And it's not about a midwife and an obstetrician. It's about going through your birth so that there's no future limitations. Because if you intervene in your first birth, your second birth also becomes, you carry that into the second birth, not only into the labor, you interfere in one birth and everything just unfolds and it all goes crazy at that birth. But then the next birth as well, you're going into it fearful and not excited about labor, or you're going into it because you've had previous surgical intervention.
Yeah.
You know, so going through the natural process and trying and increase our natural birth rate and decreasing our cesarean section rate.
Yeah.
And my ideal world would be working with government, hospitals, and giving every single mom, despite their financial constraints, every single mom deserves the best birth. You know, every single mom deserves to be treated like a queen and massaged during their labor and loved and just taken care of. And in my ideal world, that is something that I'd love.
Yeah, exactly. So in my ideal world, every community has a unit that you have. Because if every community will have that, and that will be the first line to go to for all women. We should be part of the standard of care.
Yeah.
And that we use the hospitals around us to transfer for complications. But everyone should have access to continuous care, a midwife that's there for you, that know you.
Yes.
So tell us a bit about your center.
So Birth on 5th. We now 2.5 years old, and it's a low-risk birth center, a home birth unit, right? And what moms need to know is it doesn't have a theater on site, okay? And I think the fear in the community is, oh my gosh, it's a home birth unit, it's a house so it doesn't have theater. But every single district clinic is actually like a home birth unit. There's no theater in a district clinic, and moms would go to their local clinics to give birth. That is exactly how a home birth unit functions. So the moms see us throughout their pregnancy, and then we have the honor, I always say it's our honor to be there in their space. So we have the honor of being there, guiding them, facilitating their birth, because we just don't deliver the babies, we facilitate, and they're the ones that do all the hard work. We're just there to make it easier. We incorporated doulas into our practice, so most of the packages have doulas where they get massage throughout, or we utilize all natural methods of pain relief. We try not to use we try our best not to use any medication, because once you give one thing, baby then needs the other. So if the natural birth unfolds, the higher chance of everything just going beautifully after. So we have doulas that will massage them and use all the natural pain relief and homeopathy and all of that. And then they see us so they birth, they stay in, they can have a water birth, we got your birth stool, so they use your birth stool to try different positions, and we let the mom be. And then the moms have a meal there. They get their full body massage after they're done with their birth. So we believe that moms need to be pampered after their hard work. And then they stay for a few hours until discharge. And then we see them for continuation of care until they're 6 weeks.
Amazing. Yeah, that's so beautiful. That's why I want every mom every community to have a center like that. That's the dream. That's what women deserve.
That's true. And we do. We have, so Birth on 5th is one of many.
Yes.
My colleagues, we have midwives in all areas. So just look at the midwives and look at the home birth units in your areas, because all my colleagues have magnificent birth units from the south to the north. And we all should be working on similar guidelines, which we do. And that is what they're there for. So find a home birth unit in the area.
Yes. So you can find Ruwaida also on our Find a Professional. She's birth on 5th. And as you said, there's so many midwives that you can seek out. We've got them listed on our website. We trust those midwives. We keep each other accountable, support each other. So go seek those midwives out. It will be a worthwhile investment.
Yeah, absolutely.
Yeah. Ruwaida, thank you for coming and sharing your knowledge and your passion. I could see your passion come through, so beautiful. That's what we need to see. Midwives are very passionate about what they do for good reason, because it is absolutely amazing. It's a privilege to honor, as you say. It's not for everyone, but when you're a midwife, you know it, and it's an honor. Yeah, so keep up the good work.
Thank you. Thank you so much. And thanks to you, because I mean, you do so much of midwifery empowerment, and you know, we need you. So thank you so much, Margreet.
No, everyone in their corner, hey.
Yeah.
Thank you. Hope it was empowering for you, and go find a midwife if it's your first pregnancy or your second or third, doesn't matter. It's see if it's right for you, and share this with a good friend that's pregnant for the first time, that they won't be too late to find a midwife.
Yes.
And then it's like, oh, if I only knew. Share it. Thank you so much, and we'll see you next time. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.